I'm pleased to be here today to share with you some insights that we're having at the Good Samaritan Society. But before I begin my talk today about the future, the transformation, if you will, of senior care in our country, I'd like to introduce to you my brother, Bruce Horazdovsky. Bruce works here at Mayo. He's the Associate Dean of Mayo's College of Medicine here at the campus in Rochester. And Bruce and I and my family have been going through a number of changes recently, significant changes in our lives with the passing of our parents here this past November, my mother and my father in February, and Bruce is going to share more about that story.
Our parents recently died very close together. After 63 years of marriage, I don't think they could bear to be apart. My father was an excellent planner. He spent a lot of time thinking about this journey, where I'm going to stay, making sure the bathroom door was wide enough for a wheelchair, moving to a home with a single level. What was missing was the emotional needs, and that's what really surprised me. My dad told me once in a phone conversation, "Bruce, I'm losing my wife and I don't know what to do." If that care structure isn't there, that is a challenge I think that many people face today. The journey with my parents has changed my life primarily in appreciating what they gave us as their sons. Family, respect. Not only respect for one another, but respect for those that you work with and interact with daily. That kind of approach to life and how you treat others certainly made their journey much, much more easy. You learn a lot from your parents as they walk through this particular journey. Pay close attention to what they're doing. What did they do in their lives to make those years profitable and full of benefit? They were proactive on health. I think my dad was at the end maybe just taking an aspirin. Interaction with the healthcare system and long-term planning should be a lifelong journey, not dealing with punctuated incidents. It was an honor to be part of the journey and to be an active part of that process.
That story was our story. And what I mean by ours, Bruce, along with our three other brothers, our extended family. And I want to thank Bruce. Bruce is backstage and will join us a little later on for sharing that with us. But honestly, our story is one that you already know. Or if you don't know, you'll find out later out in your lives. It's why I'm here today, to talk about that life journey and how we can all challenge ourselves to think and design differently to address aging, to support older adults and their families, and to challenge conventions about what well-being is and what it could be. Now, Bruce described so well where most of us start. It's not necessarily where we want to start, but it's so often where a crisis forces us to begin. For more than 90 years, the Evangelical Lutheran Good Samaritan Society has worked tirelessly to meet the needs of older persons and find supportive solutions for them as well as their family members. I'm humbled to say that my coworkers, the people who I honor within the Good Samaritan Society, cared for my parents in their twilight years. And I'm very proud to say that what they did for my parents was life-changing. They really, truly cared for them and loved them, as well as us as a family. And today, within the Good Samaritan Society, there's some 21,000 fellow colleagues of mine throughout this United States who right now are caring for the privileged people we have to care for within our locations of some 27,000 people in 24 different states. So at Good Samaritan, we've served generations of older adults and families really to the very best of our ability. Today, though, we're beginning to think differently. Traditionally, we have met folks like my parents and families like mine when seniors come towards that point of the end of their lives. And often when times for family members are complicated, challenged, and perhaps even torn. But what would have happened if my parents had started thinking about health and well-being, say, when this picture was taken? This is one of my favorite pictures of my mom and dad, having a wonderful summer day, I'm sure. And what would happen now if the Good Samaritan Society and like-minded organizations came together to meet families in their life journeys and found ways to support them better and sooner and with more? Would the experience we shared, my brother and my families, would that have turned out differently? Perhaps. For 90 years, we've been wedded to a model where we meet people too late in the journeys of their life to provide that difference. We've all been there. Now I suggest we start here. Over the past century, healthcare has evolved from focusing on our institutionalization, if you will, or episodic care, to something more broad as we're thinking these days. And I'd like to share with you a quote. And the quote, if you can get that to come out on screen, I think we're a couple slides behind. Health is a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. And who are we quoting here today? That's the World Health Organization in 1948. They had the answers back then. They saw a future, but there was obstacles in that future, including the never-ending challenge of dollars. And even if we find the dollars, how do we move the healthcare target, if you will, upstream to focus on maintaining health and not just trying to regain it after good health has slipped away? How can we support people both earlier and differently as they face health events that perhaps they couldn't have helped? And not only people's well-being, but how do we support people being well? And with those questions, we're facing 308 million people growing older every day. From the youngest to the most senior, people, all of them, looking for one more great day to share with somebody that they love. And that's only a fraction, quite frankly, of those who need support, because when you think about it, each one of these persons has a family, has a social network. They're not merely people who are hospitalized or rehospitalized or people who are cared for or transitioned. They're not units of therapy, if you will, but these are people with real passions, desires, and hopes. People who still long for quality life moments to share with their children, with their grandchildren. And obviously, aging and well-being can be better. And we're tackling these issues right now in the Good Samaritan Society. We need to address the realities of a new generation of older adults and families, no matter where they are in their journeys. We cannot rely solely on what we've built for them over this past century, but instead explore what will they need from us over these next 100 years. We cannot simply lead them. We need to walk with them, arm in arm, share in their journey. Here are what we think are the emerging realities as we see them. Over many decades of service, we had come to believe that bricks and mortar and campuses that build it and they will come mentality is the best way to provide and deliver health care. In the name of efficiencies, the healthcare industry has stopped meeting people where they are and became creatures of convenience. That will change. Portability of records, personal ownership of health and performance will be more transparent than ever before. Many people in this and the next generation will have less money, and so will our government. Scarcity of resources, as we know, will drive us to do more, to do it better with lower margins and with higher quality than ever before. And if we don't, we won't be able to succeed in our missions, nor will we make our businesses work. Many of us now in this room are focusing on well-being. We challenge those that we serve to, of course, eat better, exercise more, and care for themselves. Yet, we're reluctant to even gradually change our own models. We are guided by dollars that come in and invest them where we've been always investing them to preserve what we have, if you will, versus what is healthier for those that we serve. At Good Samaritan, we have a long, long history of serving older adults, but our opportunity to touch people's lives is expanding well beyond what we call post-acute care or skilled care facilities. Today, people want to thrive in the place that they call home. That's challenging us to envision new ways to realize how us, a mission-driven organization, is going to meet that challenge. By serving people earlier in their well-being journey, we are finding new ways to apply our experience in caring for the whole person, body, mind, and soul, in their place or ours. Now, 6 years ago, the Good Samaritan Society began transforming this approach of well-being. We thought about it. We began to see a new vision, a new way in which we can be about tackling this issue. And the video you're about to see really is still the driving force for that transformational vision that we see in well-being.
Look at me. What do you see? A child who saw animals in the clouds? A teenager who viewed the rest of us as mere mortals? A mother who somehow made it to being grandma? A visitor to Omaha, the beach, not the town? Or do you see what you so fear? Yourself in 10 or 20 or 30 years. Who will I be, you wonder, when I no longer do what I once did, and my body is no longer what it once was? Maybe it's time we all stopped being so afraid of getting old and cherish life for the remarkable journey it has been and that is still to come. For only then can we open our minds to living with new meaning and purpose, and fill in our spiritual blanks, and perhaps for the first time, truly experience the presence of God. The way we see it, it's not about dying, it's about living the whole of life, and recognizing that in each of us there is a friend to be made, a story to be told, wisdom to be learned. from someone who deserves to feel loved and valued and treated with dignity, even if they need help doing the most basic of things. As Christians, neither we nor Christ would have it any other way. Old age is not something to be just celebrated with greeting cards, but with all our hearts and souls. For there, with the grace of God, goes each of us.
Look at me. Seeing that reminds me, and I'm sure it does my brother Bruce, of our own journey with our parents. It stirs emotions in me that are still in the process of healing. Seeing the faces of the people on that video, my mother, my father, not in the video, but much like folks on that journey, like all of us are on that journey. It shows, in my mind, our shared opportunity for redesign, revolution, not merely revision. If all of us listening and here today focused our design minds to that vision, imagine the impact, the potential impact that we would have on people's lives around the world. So let me share with you some of the Good Samaritan Society's visions around this area, things that we're working on right now. The Good Samaritan Society has in place what we call the Vivo Innovation Center for Well-Being. Now, Vivo is Latin for I live. Vivo's purpose is to create new products and services and approaches that enable growth and transformation for our organization and for those we serve for the next 90 years. We're focused on supporting the informal caregiver as well as individuals and families throughout their lives. We're also reimagining what our communities could look like, the environments, the services that we're offering. Other Vivo initiatives include being participants in the Open IDEO initiative, that amazing initiative that you heard about earlier. And Mayo's Healthy Aging and Independent Living Consortium, called HALE, of which, along with the Good Samaritan Society, United Health Group, General Mills, and of course, our dear friends at Mayo Clinic, who initiated that wonderful opportunity to reimagine new ways and approaches. We're also collaborating as one of only 2 leaders in Connecting to Community, and that's AARP's Foundation's pilot to figure out how do we combat what they have identified, and which I think we'd all share in, the issue of isolation. And then how do we empower family members to help in that isolation? And finally, another initiative that we're partnering with others on is called Windows to the World. This too addresses isolation, but we're using technology to connect people and bring them closer together. Now, living well at home. That's a different initiative for us, one that we're extremely excited about. It currently uses sensors, telehealth, personal emergency response systems in people's homes. In people's homes to help them in their health and their well-being. We see this whole concept of living well at home, which happens to be using these 3 technologies now, but could be something else into the future. We see that as an exciting opportunity to redesign new models we haven't even thought of yet. As leaders of the largest study of its kind, we've been collaborating with the University of Minnesota to study how does sensor technology, how does nurse monitoring, and targeted home visits, how can that prevent acute episodes, predict health crisis, and empower families to participate in the caregiving? As this research is completed, we'd be glad to share with you our findings and collaborate with others in what redesign opportunities there might be for new models. And we plan also to seek funding. We think there is funding opportunities here to seek through Medicare, Medicaid, private insurers, because it's our conviction that as we intervene earlier in people's lives and help them maintain their health, that we will save the health system dollars. Now, earlier you heard me talk about my family's journey. It's really, quite frankly, a snapshot of what hundreds of thousands of other families go through every day. But I can't help but ask myself and ask you as well, what will be different? What will be different for the generations to come unless we begin to ask ourselves, what if? And not only what if, but what's next? And really mean it. Only then, I'm convinced that together, we're going to be able to improve well-being of mind, body, and soul in a different and more profound ways to help families and, quite frankly, to help ourselves. And for my family, those people who care about me and whom I so deeply care about, and whom I think we all share as we care for our own individual family members. My family's no different than yours. Let me share with you what they hope to see in healthcare, including my young grandson.
My grandparents were always very social. Their lives impacted me and influence the decisions I make today to spend time with people and to nurture those relationships, because those are important. A person's health care today isn't just about one person's life, it's about their entire family.
Your mother is the person who takes care of you, and your father's the person who takes care of you, and suddenly we're taking care of them.
Dealing with different ideas, whether that be the sick parent's idea or the doctor's idea, trying to find something that ultimately the parent is happy with and that everyone else is happy with, can be difficult.
Well-being is about balancing your time and energy between those things and priorities that are important to you and that make your life whole. For me, those things are my family and friends, my faith, my work, my health, and dreams I have.
Time between grandparents and their grandchildren is a real treasure. I think it's important to interact with those older generations and learn from them.
I know that my parents want to be close to family, and as they reach retirement in the next several years, that they're looking to move where the majority of their kids are, and their kids would love that too. And I want to help them find the environment that they're happy in, figure out how to make that work for them based on their health needs.
For my parents, they enjoy being at the lake and being at their home. Staying healthy and fit and being able to stay in that place, and as they need help, maybe bringing in outside services to help them stay where they want to be and be doing the things they want to do.
At the end of the day, the relationships you have, especially with your family, are probably one of the most important things in your lives.
I invite you to join us and come along on this journey. Actually, I would ask that you would come with us. Join in us in our 90 years of history of caring for thousands of seniors and their families. Together, we can think and we can redesign differently to address aging, to support adults and families, and to challenge the conventions of what well-being is and what it could be. Now, let's start here. Thank you.
So let's get the family together here for a few minutes. Thanks so much.
We're kind of the look-alike brothers.
Yeah,
kind of.
Well, we're not going to do a genetic test or anything. I believe you. Yeah. Right. Yeah. I'll go with it. A couple of things. We began with the idea of community. We really sort of end here with the idea of community, and that idea I think will be extended in our final session. I'm wondering, with your experience, are only families able to confer that dignity that was so important in the characters that you described in that second video? Is it really only the families being there for their senior members that confers that dignity, or can a community be created inside an institution of non-family members that can confer that same kind of dignity?
Well, I think we're all one extended family in community, if you will. So often we think of healthcare, of the doctors and the nurses and all of our certified nursing assistants, but the largest number of caregivers in this country is the informal caregivers. And when I mean informal, it's certainly family, but it's the community in which we live and how we support one another. So most definitely, it's an extended family that we should all participate in.
I believe it's something on the order of 30 million caregivers in the United States right now dealing with one kind or another. A large chunk elderly, but by no means the only. I worry about the technological application of sensors sometimes, because I feel that the I've fallen and I can't get up model of care doesn't necessarily empower families. It almost disempowers families in the sense that there's a kind of electronic custodian that produces some sort of detachment, guilt. I mean, how does that work with you?
I think sometimes people might first think that way, but it's been our experience as we've been about this now for a number of years. Once we engage the person whom is receiving the care and support, the families, it's liberating for them. Once they understand this isn't about cameras, this is about ways in which we can help you maintain your independence. We can help you, family, to support that loved one to maintain independence. And once that triggers in their mind, then they see that as a friend, a way to support their well-being, if you will. It's almost a stereotype and a hurdle we need to get over, because it isn't a big brother approach. We've had those conversations, and we find people, once they get it, they're engaged with
Way
it.
past that.
And they see it as a partner for their health.
And the smartphone world really transforms that completely. What's more challenging, maintaining an individual in their home or finding a place for them in a family home?
Yeah, that's interesting. My mom would frequently say towards the end of her life, "Can't I just come home with you?" And that's heart-wrenching. You hear that. And then we would talk about it, and then she came to realize that her family at the Good Samaritan Woodlands facility were taking such good care. 15 people take care of me. And that was sort of something that actually I found to be a great relief. There's guilt there, there's no doubt about it, but to be able to reach out to family, direct family, extended family as you're going through this is quite remarkable and quite reassuring. And if in my dad's case, didn't participate in electronic sensors or things like that, he helped test them, but he just felt that, the community he had around him took good care of him, and in fact, they were his sensors.
Is the assisted living industry a progressive movement or a business model that potentially exploits the growing population of people who are in that world of marginally independent?
I think we're at a wonderful time in the history of providing care for seniors, and part of my message today is often these folks are forgotten, and these are the folks who hold the wisdom, if you will, of our country. And where we care for them, how we care for them, whether it's in assisted living, and certainly that makes a lot of sense for a lot of people, or skilled care, because people do have chronic disease and some people will not go home, or in their home. The mentality for us at least is it's not this or that, it's what do you need? And how our challenge as an organization, how do we move our service, how do we move our doorstep, if you will, our threshold to wherever you call home, and convert our systems and abilities to maintain health and well-being wherever that might be.
You've done a lot of research. When does old age start?
Now.
Now? Yeah. Thanks, guys. Thank you very much.
Thank you.
Okay.
Pleasure. Thank you.